Hello, thank you for joining us again. We've got Christian Provenzano on the line here. The mayor has agreed to once again answer your questions. Yesterday, SooToday readers were very busy emailing in many questions. We've narrowed it down to some of the ones that came in by sort of a cutoff yesterday afternoon. So I guess we can get right into them. Thank you again, Mayor Provenzano, for joining us.
Yeah, thanks for having me, Mike, and thanks to the team at Village Media for doing this. I think it's important that we talk to each other and answer people's questions.
Excellent, and yeah, we very much appreciate it. So the first question was something that came in to me via Facebook. There's a local resident who, I guess, every spring does some yard work for people he knows, sort of casually. I'm thinking he's removing rocks and debris from their yards. He's wondering, is that something that he should be continuing to do right now?
So just to be clear, is this somebody working in their own yard or somebody going out to work in someone else's yard for hire?
Someone else's yard for hire.
Yeah. So I've got to be careful about what I kind of advice I give on this. Not only because of my position as a mayor, but these are legal issues. And as many people are aware, I'm also a lawyer. So some people might construe me as giving legal advice here. The reality is the province has put out an order of what businesses are essential and what businesses are not essential. I think there's an argument that can be made that landscaping is essential based on the order. And I'm just saying that based on the order, but I can't give anybody permission to go out and landscape. I think whoever's in that business really has to look at the order themselves. And the proper party to ask would be the provincial government, because the provincial government is the one that put the order out. So the provincial government would be able to give you certainty as to whether it is of the opinion that landscaping is an essential service. If landscaping isn't an essential service, then you shouldn't be engaging in it. But the person who asked you the question really should approach the province on that, or get legal advice from their own legal counsel about whether or not they fall into the order and whether or not they are an essential service or not an essential service. Certainly, anybody can go out in their own yard and do their yard work. The question is whether you can hire someone to do it, but I'm not in a position to specifically answer that.
Okay, thank you. I think that'll be helpful. This person has some more research to do and some help to get to answer that question. Another question that we got in, this is kind of a follow-up. Last week, I think you were asked by a reader what the city's doing to keep costs under control, and whether or not that had meant impacts on city employees at this point. So someone's saying, is there a way to be more specific about that? Is there a rough percentage of in terms of layoffs? Can we be more specific about how the city's handling that?
Yeah. So a while back, frankly, near the beginning of this, as I indicated last time we spoke, the city laid off all of its part-time and casual workers. I didn't have the number with me the last time we spoke. I've since asked about that number. So the city's issued over 180 records of employment. So when you lay someone off, you issue them a record of employment. So we've issued over 180 of them. So that's a considerable number. Last time when we talked about this, I was kind of using some comparative examples as to what we do in our community and what other people do. And I think that's relevant, Mike. And I think it's important that we consider that, because if you look at the KPMG report that was before council a couple months back, one of the things that KPMG said in that when they did their audit of our services is everything we're doing here is either mandatory, we have to do it, or expected. That we're not doing anything here that is in excess of the mandatory and expected levels of service. So if you look at let's just take police and fire. We have well over 300 employees in those two organizations. We can't lay off any of our police or fire employees or the civilians that support them. Those are essential services that we have to keep on engaging in. The next biggest department we'd have is public works. We're still providing public works services across the city. We still need our employees to keep the city up and to do what we're generally doing. We need to have our landfill open. We need to pick up the garbage. So the city has been very diligent about looking at the services it's providing and keeping the people employed. We need to provide those services. One of the things that we've done besides our layoff, and I think you'll agree with me that 180 plus records of employment is a lot, is we've paused and gapped hiring. So as people have retired or if people have left employment at the city, we haven't been replacing them in the interim. In the meantime, the CEO looks at it, and if it's critical, he will authorize the replacement of that person. But generally speaking, he hasn't been authorizing the replacement of anybody throughout this period. So that also, those aren't ROEs, those aren't records of employment, those aren't full-time equivalents laid off, but they're full-time equivalents that aren't actually hired or engaged or working right now. So that's also important to recognize. And another thing that we've done is some of our staff, we've redeployed them to other functions that are important for the community. And we have to be mindful of the fact that we've also had to do some additional work as a city, like, keeping our transit fleet cleaner and making more of an effort to make sure the transit fleet is cleaner. Our facilities have to obviously be cleaned more frequently. So we have additional work that we've had to undertake. And on top of that, we're trying to be ready for when we transition out of this. So, if you take our building department, they're still working in there and they're still taking in applications and they're still taking in people that want to get work done and want to start projects. We want those people to be able to start the projects as soon as they're allowed to start the projects. So we can't let all that work pile up and then have our staff come in once we can get to that work and then have a delay in the building community. So we're processing that work now. So we're trying to balance our obligations to the community to keep things moving with our obligations to the taxpayer to be respectful of tax funds. But I think really the senior staff here and the CEO have done a very good job, and I think they've taken very good measures. And we'll be discussing them in full at Monday's council meeting. But I'm satisfied and confident that they've done what they can do to minimize the impact to our taxpayer.
Okay, excellent. I think that'll give people some more clarity on that and some sense of the balancing that's going on in terms of keeping the city actually running and prepared to bond and saving money at the same time. Excellent. Next, a couple of questions I think are sort of basic can I do this and can I not do this questions, and I hopefully you can give people some guidance here. Someone's asking, whether if you are living in an apartment, should people who live in the same apartment building be gathering together in common areas, and how should they be handling that?
And they shouldn't.
Right.
No, they shouldn't.
So unless you're living in the same apartment.
That's right.
Together.
Yeah. It's the Algoma Public Health, I think, is very clear about that. And that's something we are looking to avoid. So if you live in settings that have multiple units, you should really be socially interacting with the people in your unit and not in the broader building.
Okay, excellent. And this is probably not something that you have direct control over, but does the city have any discussions with grocery stores, and is it something that they would ever suggest, or maybe in conjunction with Algoma Public Health, to encourage them to have one-way lanes in the grocery stores and to maybe enforce that or make sure that's happening?
So listen, I think it's a great suggestion. I agree with it. It's something that I have raised with Algoma Public Health. At the outset of this, at the very beginning, I called all the grocery store management in advance of any changes really being implemented, just recognizing the amount of work that was coming and just thanking them in advance and asking them to thank their staff in advance for the sacrifices they'd have to make. That specific issue with one-weighing the aisles in each of the grocery stores, we have seen that in some of the stores. I think Walmart's done that. I think Rexall's done that. It's a good idea. It's something I've raised with Algoma Public Health, and frankly, the issues of grocery stores is something that I've talked to Algoma Public Health about all throughout this challenge. It is something that's been top of my mind. It's probably been something that I've received more communications on than anything else from the community, and something that I have talked to Algoma Public Health about frequently. The city's been very conscientious, though, about interfering in different kind of responsibilities. So this really is Algoma Public Health's responsibility, and we're working closely with Algoma Public Health. And one of the things that you have to do when you have a good working relationship and you're trusting each other to do each other's to do their respective jobs is you have to respect each other's responsibilities. And we respect Algoma Public Health's jurisdiction in this respect. So, we have talked to them, we have raised ideas with them, but Algoma Public Health is working directly and closely with the grocery stores. They have teams that are assigned to each grocery store, and that the public health inspectors are dealing with the management of the grocery stores, and they're working with each other and talking to each other about best practices. So we've really been diligent to communicate our ideas and thoughts with Algoma Public Health, but also respectful of Algoma Public Health's jurisdiction to implement these plans with the grocery store. So yes, to answer your question specifically, it's something that can be done. It's something that the grocery stores can implement. It's something that some of them, some stores in the Sault have implemented, some grocery stores across the province have implemented. And I think it makes a lot of sense. I'm the one that does grocery shopping in my family. And when you're all going the same way in the aisle, it's pretty easy to maintain distance. When you have two-way traffic in an aisle, it's difficult to maintain distance. So is that something I'd like to see across the grocery stores of the city? It is something I would like to see across the grocery stores of the city. But I'm going to trust and respect the work that Algoma Public Health is doing and the management of the grocery stores to make those decisions. And, I have shopped at a number of them across the city since this started, and I think a lot of good work has been done. And I'd just like to take a second to thank all of the people that work in our grocery stores and are going to work every day and frankly, exposing themselves to a higher level of risk than the remainder of us. So I want to recognize and thank them for that.
For sure. So the next question, I'm not sure what the situation here is regarding the landfill. Someone's suggesting that maybe the landfill for branches and clippings and yard debris is not open. I'm not sure if that's the case or not. And then someone's suggesting like, hey, maybe it should be free. Maybe you could answer both of those questions.
I can. So I'm certain that you can bring your yard waste to the landfill. Now, I think the city will start its yard waste collection around the second week in May. For some reason, I'm thinking May 11th or so, but let's just say the second week of May, the city will be starting its own yard waste collection. So you can bring your yard waste. We will start picking it up in May, and that process will start. As far as waiving the fees on that, one of the things that's difficult about waiving the fees on some items going into the landfill and not others is many people don't just go up there with a bag of yard waste, right? Like most people that are going to the landfill are going to the landfill with a number of things, and you're weighed when you come in and you're weighed when you come out. So it's not that simple to waive fees on just certain parts of what's going in there. It's just from an administrative perspective and from like an ease of operations perspective, it's just easier for us to charge for everything going in there because of the way we accept it. So it would be difficult to do that.
Okay, fair enough. I thought it was interesting. At least there seemed to be some confusion about what was going on there. So at least we can clarify that for people.
Yeah. People bring their yard waste up, and we'll be picking it up in a couple weeks.
So another reader suggests, is there a way to do any kind of screening for people coming in and out of the city? Now, I don't know whether that's something that we would even be able to do, but is that something we've thought of, or is that something that's in any plans at the moment?
So what are our entry and exit points, right? So one is the bridge. That's entirely controlled by Canada Border Service Agency. We have talked to a CBSA, the CEO's talked to the CBSA. I've talked to our member of parliament about activity, international activity at the bridge. I've also spoken to the Deputy Prime Minister, Chrystia Freeland, about it. And it is their responsibility and jurisdiction. And I trust they're sensitive to those challenges and issues, and they're doing good work there. But we don't, as a community, as a municipality, exercise any control over the international exit and entry points. So that leaves the highway. The highway is provincial. We can't, as a municipality, set up some police cruisers on the highway and stop people and then screen them. Outside of the fact that we would have to set up our own police to do that, they don't have the jurisdiction to do that. So the highways are the provinces, and really we can't set up a screening system where people are coming into the city on the east and leaving the city, in the northwest, and saying, what are you doing, and what are you doing here, and do you have symptoms? So I understand the desire, why some people might think that's a good idea, but it really is way outside of a municipality's jurisdiction and, frankly, ability.
So I think this question speaks maybe more to what the city can look at. Someone is suggesting that there's repeated gatherings out at Pointe de Chêne, cars showing up. Presumably, they're saying that people are gathering in inappropriate numbers. Is that something that you've heard of, and is that something that
No.
police are looking at?
So the question that you sent was the first time I'd heard that. I can tell you I've already brought it to enforcement's attention. That should not be happening. So that is our jurisdiction. That is our responsibility. That should not be happening. That park is closed. And because of that question, we will be going by there more frequently, and we will be looking to enforce those provisions more aggressively in that area. So message to anybody doing that, thank you to the person who asked the question. Message to the people that are doing it. We're going to be watching for it, and the Sault Ste. Marie Police Services will be checking that out. And the CEO is aware of the issue now, and he's going to make sure that we enforce on that.
Has that been an issue? People gathering at parks? I know there's obviously a number of people sort of walking through parks, which my understanding is still allowed. But has it been an issue in terms of generally the city's parks being a gathering point?
I'd say generally it hasn't been. No, it hasn't been a significant issue. I live up the street from a municipal park, and it's been empty. Yeah. We see people walking through Bellevue Park frequently, and that's okay, but nobody's congregating at Bellevue Park and socializing at Bellevue Park. People, and we want to get, people need to get out. They need to be active. They need to get some fresh air. They need to move around. And we get that. We want to encourage that. We haven't seen a significant amount of misuse of our parks.
Okay. Excellent. Okay. Here's another one. This is, I think what the person's trying to get at is, are you satisfied with the way Algoma Public Health is reporting the numbers of cases in the city? Now we've heard some, there's been some talk just about how they have released those numbers and whether it's specific enough. I know they've recently changed the way they're reporting that. Are you satisfied with the way? Do you want any more specific numbers about Sault Ste. Marie, or is this what we're getting now good?
We have the specific numbers in Sault Ste. Marie. I think where you don't have the specifics is for the smaller communities. Right. But Algoma Public Health website has identified 8 of the 12 positives were in Sault Ste. Marie. So that information's there. It's available to the public. So there were 12 positives. 9 of those positives have been resolved now. 8 of those positives were in Sault Ste. Marie. So 8 of the 12 were here. Look, I can speak to this larger issue about how they've reported things. When we had the first case, and I was told that there was a first positive in Algoma, you can expect, Mike, what my first question was. Like, I'm the mayor of the city of Sault Ste. Marie. My first question was, is that positive in the city of Sault Ste. Marie? And they wouldn't tell me. And my reaction to that was a bit confused and a bit bewildered. I thought I should be told, but then I reflected on it, and I asked. I said, well, why can't I know that? And then I understood, and I thought their answer was pretty reasonable. At the outset, there's a bit of a problem with having small numbers, and that, let's just take, for instance, that first case. Let's say that first case wasn't in Sault Ste. Marie. And if you think about the person's age and their gender and the fact they traveled and all the details that were raised in that first case, and if you put a community on that case, if you say, and this person lives in, pick a community outside of Sault Ste. Marie, one of the small ones, whether it's Blind River, or whether it's Prince, or whether it's Echo Bay, whatever the community is. If you say this person lives in that community, they could, with that information, potentially identify the person. So at the outset, they said, look, we want to get to a place where we could identify how many cases are in each community. But until we have larger numbers, it's going to be difficult to do that, because we could potentially give away somebody's identity, which is contrary to our responsibilities as a health information custodian. I have some experience with that legislation in my private life as a lawyer. prior to the work as a mayor. I understand the obligations that health information custodians have. I understand the restrictions in that legislation. It's pretty significant legislation. So I understood why Algoma Public Health was sensitive about releasing too much information that could identify a person. But they told me from the outset, when they got to a place where they could release more information, they would. And I think we saw them get there, and I think we saw them be true to that. And now they're identifying how many cases are in each of our respective communities. And I think, frankly, that when you go to Algoma Public Health's website, you get as enough information as a citizen as you need to really understand what's going on. And frankly, the secondary issue was whether the case was here, that first case was here, or whether that first case was in one of the other communities that are around Sault Ste. Marie. I still felt like the first case was here, right? Whether it's here or in Prince, or here or in Echo Bay, or here or on St. Joe's Island, that is part of our community. Like, that case is here. And, you know, people live in Prince, they work in the Sault. They live on the island, they work in the Sault. So I wasn't as I don't think fussed at the beginning of this as you know, a lot of people were, about the fact that with each case they did identify the community. But if you look at their website now, they very clearly say there's 8 cases. There was 8 cases in Sault Ste. Marie. So I think they're doing a pretty good job of giving us the information we need. And, you know, they've got a really tough job here. And there's a lot of really good people in Algoma Public Health doing a lot of really good work. And my feeling at the outset of this, and my feeling still is, when we get to the end, we all need to reflect on the jobs we did. Algoma Public Health does, the city does, the province does, the federal government does. And we all need to reflect on that and see what we did well and what we could have done better. And we need to learn from that. But while we're in the midst of it, I'm not looking to create any tension or confrontation with any of our partners that are collectively working on this challenge together. I want to just have positive, constructive working relationships with everybody, and I want to move through this. You know, there are decisions that are being made very quickly by all orders of government, and, you know, with some distance and some time, maybe we'll consider some of those decisions, and we could have looked at them and made them better at the time. But for now, none of us get any farther down the road, and none of us meet our goal if we are opposing each other. We all have the same goal right now, which is to keep the communities and the people in those communities that we represent and we care about healthy and safe. And I think we achieve that more by working together, and that's been our focus as a community. So I want to recognize the good work APH has done. I'm satisfied with the work they've done, and I'm satisfied with the information they're sharing. And I think if you go on their website, you can see now that they identify the community, specifically in the number of cases in the community. And on a going forward basis, as more positives are developed, they'll change those numbers. But when you look at the numbers coming in, you get a lot of information.
Okay, excellent. Thank you. And thank you for summarizing the sort of how that's evolved for people so that they understand that. I guess back to some of the restrictions that are in place. We've already gone over sort of that in general, people are being pretty good about how they're dealing with parks and gathering. It's a question that we keep getting week after week, and I'm not sure whether this is a problem, but people are asking again, is there some kind of a curfew that should be put in place? Has anything changed in terms of that?
I don't think it has. Like I said, I would largely defer to the police chief's opinion on that, because it would be up to him to enforce that, right, through the Sault Ste. Marie Police Services. And we have a really engaged police chief. He's a really competent, experienced, capable person, and I trust his judgment and his assessment. Putting a curfew into place would take a tremendous amount of resources to actually enforce. So then we would have our service engaged in enforcing a curfew. So what's the purpose of the curfew? I personally don't believe that a curfew would result in anybody who's engaged in the break and entering activity we've seen, people that are disposed to engage in that activity, they're not going to care if we have a curfew. And they're not going to respect or abide by that curfew. You'd have law-abiding citizens who care about the law that would respect the curfew. Well, those aren't the people that we're concerned about in any event. And those people aren't going to engage in any activity we don't want them to engage in, whether it's after 10 o'clock or after 9 o'clock or after 11 o'clock. So I frankly don't think a curfew would be very effective. And I think a curfew would take a significant amount of resources to actually enforce. but I'd largely defer to the police chief's judgment in this respect. If the police chief came to me and said, we think we need a curfew, I would completely support his judgment in that respect, but I don't think he's drawn that conclusion. I don't think he thinks that would be an effective tool to put in place. And I think it would take a tremendous amount of the forces, resources, and time to enforce it. And I don't know that would be how we want to spend that time.
Okay, excellent. It's a question we keep getting asked, but I think that probably sums it up. I think those are the questions that I think we've got right now. We're getting to a point where it's probably beyond what people have attention span to watch. But I do want to give you the opportunity if you have anything you feel that you should address right now.
I have one message, Mike. I want to thank the community for the really good work it's done to date. I've been proud of the community, impressed by its response to this challenge. The leadership of the community across all of our agencies has worked together really in a tremendous way. But all of us, everyday citizens of the community, going about their everyday, are making a tremendous amount of sacrifices. And they're making those sacrifices not just for themselves and for their family and for the loved ones, but for the community at large. We're asking a lot of people to change how you go about your day on a day-to-day basis. We're asking a lot of people when we ask them to stay home. And I just need everybody to hang on for a bit here. I know it's getting hard. I know the time's getting long, but I really feel like if we push through and if we really commit to what we've been doing, if we really commit to Algoma Public Health's advice for a number of weeks coming here, we'll be in really good shape. We need to keep doing what we're doing. If you have COVID-19 symptoms, you have to self-isolate. If you don't have COVID-19 symptoms, we need you to stay home. If you have to go out, we need you to practice physical distancing. Wash your hands, don't touch your face. I believe that in a few weeks' time, mid-May-ish, we'll have a lot of clarity about where we're at and where we're going, and we'll have some clarity from the provincial and federal governments about our path forward and about a transition away from the state we're in now, which is close to a full lockdown, to a different intermediate state. But we need to keep on doing what we're doing. And I think there's a risk when you look at the city's numbers and saying, hey, we're doing pretty well, our numbers are low, we can go back to normal. But the reality is, if we go back to normal, there'll likely be a spike, and then we'd have to start again. And that's what we don't want to do. We don't want to lose the progress that we've made, and we don't want to lose the good work that we've made. So we need to stay committed for the next few weeks. And I think if we do, we'll have a lot more clarity. So I need people to hang on. I need them to have some patience. I need them to keep on looking out for themselves and their family and their loved ones in our community at large. Let's keep on following Algoma Public Health's advice, and let's stay committed for the next few weeks, and we'll be able to reassess things then.
Okay, great. Again, thank you very much for doing this. We very much appreciate it.